As probably most of you know, my name's Padman. I'm the Chief Medical Officer here at Astron. It's a real privilege to speak with all of you here today. A little bit about what we do at Astron, why we think it matters, and how we think our approach can offer new possibilities to you or anyone that you know who's living with cancer. You're going to hear some words today, so I'm going to do some definitions at the start, and I appreciate a lot of you will know what these words mean, but I'm just sort of doing them to make sure we're covering all of our bases here. So the words precision oncology are going to come up again and again today. And I just wanted to define what I think it means in this context, which is that we want to match the right treatments at the right doses to the right patient based on the specific biology of their cancer. So it's not about using generic protocols. It's about personalizing your treatment based on the best available scientific evidence. And so in terms of what we do, the aim at Astron is really to be your personal cancer research team. In practice, that means employing cutting-edge molecular testing to uncover the specific drivers of your cancer, and then using our bioinformatics engine to suggest safe, science-backed ways to target those vulnerabilities most effectively. There's, again, quite a lot of scientific terminology in there, and I just wanted to define a few of those things. So when we talk about molecular testing, that really means analyzing the DNA and the RNA in your cancer cells to see what's going wrong at a microscopic level. It's a bit like mapping the engine of a misfiring car to see what's going wrong. And then in terms of DNA and RNA, I know that most of you are aware of what these things are, but they're like the instruction manuals inside every cell. The DNA ultimately tells the cell what to do, and the RNA helps carry out those instructions. When these are damaged or mutated in cancer cells, they can help drive growth and spread. The other terminology I wanted to go through is bioinformatics. And when I talk about bioinformatics, we're really talking about advanced computer science and machine learning models. And Sam's going to speak to that a little bit later. But our model, we've specifically trained on tens of thousands of scientific papers to help match the molecular vulnerabilities with existing cancer treatments. And our aim really is simple. It's to support your standard cancer treatment with highly targeted additional strategies that may help improve the effectiveness of those treatments, stabilize your disease, or reduce the risk of recurrence. So I wanted to talk a little bit about why this group of us decided to build Astron Health. And so for me personally, for over a decade, as a lot of you know, I've worked at the intersection of cancer medicine, biology, and drug repurposing. And drug repurposing really is using medications that are already used and licensed for other illnesses, but which also have some level of evidence they may help in cancer as well. At times when I was using non-personalized protocols of these repurposed drugs in cancer, often those treatments would work well, but I also saw that sometimes they didn't. And I believe now, looking back on it, that was because we were using the very same approach for patients with very different cancers. Under the hood, one patient's tumor may have completely different molecular drivers than another, even if they had the same tissue diagnosis on paper. And that really led me to realize that we needed something radically better, something that recognized cancer not just as one disease, but as hundreds of complex, biologically different conditions with wildly different drivers at every level of biology: genetics, metabolomics, looking at the immune system, the microbiome, and more. And we now have access to really advanced molecular testing at a much more competitive price point. And I think combining that testing with the massive potential of machine learning to help make sense of vast quantities of complex data really lets us analyze each person's cancer in detail. And that's really why we built Astron, to take advantage of that opportunity to build precise, personalized, research-driven reports for every single patient that we work with. So looking at the engine of Astron, I just want to start with something important. You know, the phrase precision oncology that we talked about earlier is everywhere these days. But in many cases, it's a misleading label, especially for patients. Current so-called precision oncology often involves scanning a molecular report for a few well-known mutations and then seeing if there's a drug that matches. But in reality, the drivers of cancer are far more complex. Cancer genomes, just by their very nature, are messy. And according to the COSMIC database, which stands for the Catalogue of Somatic Mutations in Cancer, Sam's going to touch on this a bit later, There are over 750 known driver mutations in cancer, yet fewer than 50 of those have approved drugs that target them. That's less than 7%. The rest are currently undruggable using conventional oncology toolkits. And that means that most patients undergoing molecular testing today through their primary oncologist won't find a match to an available therapy. It's like searching for a needle in several haystacks. Essentially, we can identify the abnormalities that might be driving someone's cancer without having the tools to act upon them. And part of that problem is that traditional drug development just can't keep up with molecular science. Bringing a new cancer drug to market takes an average of 12 years and costs somewhere between $2 and $4 billion. Meanwhile, the amount of molecular data we can generate through next generation sequencing is growing exponentially. We're producing way more information than the current pharmaceutical pipeline can respond to. And that's where we come in at Astron. We believe that the answer lies in bridging this gap with repurposed drugs, supplements, rational combinations of existing therapies that can target these molecular abnormalities now, not in 10 years' time. Every cancer is unique. Even two patients with the same tissue type may have completely different molecular drivers, as I mentioned earlier. And by doing this profiling, we can really take a deep dive into your tumor's DNA, RNA, and protein signals to figure out what's really causing it to grow or spread or behave abnormally. And then we have the data we need to research the best evidence treatments that match those vulnerabilities. This depth of precision really means that an Astron research report won't suggest any treatments based on guesswork. Every recommendation is linked directly to your cancer's molecular vulnerabilities and is supported by the best evidence data available. I think it's really helpful here to draw a quick comparison with heart disease. So when someone has a heart attack, doctors often do emergency treatments, placing a stent or performing a bypass. And that's the immediate high impact intervention, a bit like surgery or chemo or radiotherapy in cancer. But after that, the real progress in outcomes and preventing recurrence came from addressing risk factors, lowering blood pressure, managing cholesterol, stopping smoking. And these secondary prevention strategies have had a lot more research funding spent on them than the primary treatments in cardiovascular disease. But in cancer, we haven't historically had a similar risk factor-led approach because cancer is far more complex and heterogeneous than cardiovascular disease. This is what molecular testing gives us. It gives us the opportunity to identify those hidden cancer-specific risk factors, the ones driving recurrence and progression, and enables us to address them directly.